Thank you all for joining us. My name is Nathaniel Van Kirk. I'm a clinical psychologist at the OCDI, and I'm also the vice president of OCD Massachusetts. So thank you all for joining us for our virtual monthly lecture series. It's my pleasure today to be moderating this and to invite Dr. Jennifer Cullen from the OCD Institute to come talk a little bit with us about how to incorporate ACT into exposure response prevention for BDD, or body dysmorphic disorder. And so a little bit about Dr. Cullen. So Dr. Cullen is a staff psychologist at the OCD Institute. In addition, she also runs a private practice focusing on OCD and related disorders and anxiety disorders, as well as highly involved in the clinical training program at the OCDI, and has trained a number of the clinicians, staff, and students that have gone through the program. So Dr. Cullen completed her PhD at Western Michigan University, followed by a postdoctoral internship at Albany Medical Center. And then in 2001, you started at the OCDI as a postdoctoral fellow, right?
Did.
And you've been there ever since, kind of leading the way and doing a lot of the treatment around BDD and how to integrate ACT into ERP, both on a clinical and on a research front over the years. So it's a great pleasure to have you with us. Thank you so much for joining. And just so for everyone who's in attendance, if you have questions, please drop your questions in the Q&A box. And then at the end of the presentation, Dr. Cullen and I will have a little bit of a discussion, and I'll kind of read off the questions, and we'll make sure to try to answer everyone's questions throughout the time. So if anything comes up, please feel free to reach out to us in the chat or in the Q&A box. And with that, I'll turn it over to Dr. Cullen.
All right, thanks, Nathaniel. I appreciate that introduction. So good evening, everyone. My name is Jen Cullen, and like Nathaniel said, I'll be talking about how to incorporate ACT, acceptance and commitment therapy, into ERP, exposure and response prevention treatment for BDD, body dysmorphia, lots of acronyms there. So I've been treating BDD since about 2001, and I absolutely love working with this patient population. And so I'm really happy to be here tonight to be talking about how to do this. So what is body dysmorphic disorder? So it's a preoccupation with one or more perceived defects or flaws in physical appearance. Well, let me see, I'm going to move my box up just a little bit. There we go. That's not observable to others, or other people might see the slight defect, but see it really as slight. But to the person that's experiencing body dysmorphic disorder, they don't experience that defect or flaw as slight. What happens when people with body dysmorphic disorder look at themselves and their quote unquote flaws, their distress will go up. And then in an effort to decrease that distress, they'll engage in some sort of compulsive behavior. And those compulsions are usually done in an effort to perfect or improve or change what they're seeing to be as a defect. The prevalence in terms of BDD is really sort of unknown, but what we do know is that about 1.9% of the community suffer from BDD. About 7.4% of people on an inpatient unit suffer from BDD, and about 5.8% of outpatients. This is a disorder that is equal in males and females, which to me, when I first learned about BDD, I was pretty surprised about. I made assumptions that it would be higher in females. And the common age that people usually begin to suffer is somewhere in the early teens. So there's a few disorders that often go hand in hand with body dysmorphia, and they're major depression, social anxiety disorder, and then substance related disorders. Unfortunately, the suicide attempt rates in adults are really quite high in body dysmorphia. We see a 2.6-fold increase in adults versus other disorders such as OCD. So that's a pretty steep jump there. And we don't know the exact prevalence of this disorder because there's a lot of people suffering with BDD out in the world, and they don't even know that they have it. They're just not not sure what's going on. So we really don't know the exact prevalence rates. So how does BDD present itself? Right when I feel like I've heard every single way in which BDD can present itself, somebody teaches me a new and different way. But most people with BDD are preoccupied with about 3 to 4 different body parts. And the skin, the nose, and the hair are the most common. Now, there's tons and tons of examples. I put just a couple of them up here on the slide. So if we're thinking about hair, someone might say, my hair's too thin or too curly or too straight, or my hair's receding. My nose is too large, too crooked. My skin is too red, too pale. I've got severe acne, wrinkles, etc. So you see the possibilities are endless in terms of what people with BDD can be preoccupied with. And usually the description of what they're preoccupied with is pretty specific. So there are a few barriers to treatment. And the first one, most common one, is this feelings around shame and embarrassment. All right. And people not wanting to sort of bump up against that shame and embarrassment can really be a roadblock for people. You know, I've had patients say to me, it took me so long to come get treatment because I knew that if I went to go get treatment for the BDD, I'd have to tell the clinician, hey, I'm preoccupied with my nose. And then what is the therapist going to do? They're going to look right at my nose. And I didn't want to draw attention to myself. I'm so ashamed of my nose. So I just didn't go get help. I think other people also feel like if they're going to a therapist to talk about their appearance, that they will be seen as vain or selfish. And, you know, BDD is not a disorder where people are looking in the mirror and saying, oh, yeah, I look really good. It's actually quite the opposite. Another barrier to getting treatment is that people with BDD often don't seek out psychological type treatments because they believe that their flaw is real. And so usually they will seek out cosmetic treatments instead of psychological treatments. A phenomenon that happens in some people with BDD is that they might have really poor insight and can even become delusional about their appearance and really sort of convinced that, you know, their nose, for example, is too big. And so why would they then go get treatment from a therapist? And then we have the typical logistical and financial barriers that a lot of our patients bump up against. In one study, about 1/3 of people with BDD reported they didn't even know where to go for treatment, who to see. And then another barrier is that it costs a lot of money to see a specialized provider. It's not cheap, and so the cost is definitely a barrier. And then it can just be really hard to find somebody who specializes in treating BDD. You know, a lot of people might say that they treat BDD, but when you sort of look under the hood of the car, they're not using empirical treatments. And if patients have had a bad experience with a therapist who didn't really know how to treat the disorder, they may not go and get treatment from a subsequent provider. So what is the gold standard treatment for BDD? It's called exposure and response prevention, or ERP for short. ERP is the same treatment that we use to treat OCD as well. And so I'm not going to spend a lot of time on ERP, but in a nutshell, this is what it is. We ask patients to enter into feared or avoided situations, while at the same time, they're exposing their quote unquote defect to the world and they're simultaneously resisting compulsive behaviors. So we have repeated exposure without doing rituals, and what this leads people to is fear and anxiety gradually decreasing over time. Well, how does this happen? Some of the things that I've heard patients say is that they no longer fear what they used to fear, that they thought, oh, I just didn't think I could handle the fear and anxiety with going out into the world and people seeing my X, Y, and Z. Some other people will say, gosh, people just weren't paying attention to my X, Y, and Z as I thought they might. So what do we as providers do here? If any of you are going to go see a specialist for BDD, it'll look something like this. They'd talk to you about all the different parts of your appearance that you're preoccupied with. And then they would come up with a list of rituals with you, because the treatment is all about resisting rituals. And some of the more common rituals that I put here is mirror checking, alternatively avoiding mirrors. The comparison ritual. So if I had BDD around my hair, I might be comparing my hair to everybody else's hair that I see. Pinching, for example, your stomach, excessive weighing, camouflaging behaviors are very, very common. So that might be if somebody had BDD around receding hair, they might wear a hat all the time. Or one time I treated a patient many years back, and he believed his face to be quite narrow. And so he would hold his hand up to the side of his face so that it looked wider. Then we have excessive washing and grooming routines, doctor shopping, another very common ritual. Looking for a medical doctor to fix or help the patient perfect their appearance. Researching on the web. Pretty much every patient I've ever treated with BDD Googles and tries to figure out ways to improve their appearance. Seeking reassurance from other people, and also giving themselves reassurance. So maybe having to sort of give yourself a pep talk before you step out into the world. Then we list all the things, the places, the people, etc. that people avoid. And then we develop this ERP plan. And essentially what we do with that plan is anything that people are avoiding, we put that on the to-do list. So for example, if somebody avoids going out and doing some sort of shopping during the daytime hours, we might say, all right, let's send you out grocery shopping during the day, not at night. And while you're there, you'll resist the rituals that you would typically do. So how do we use ACT to treat BDD? Now, it's not ACT, it's ACT, and this is acceptance and commitment therapy. Now, ACT is actually, it's an exposure-based therapy, and so it's important to just sort of highlight that if you're doing ACT, if that's the treatment that you choose, then you'll still be doing exposure therapy, and you'll see how this works in a moment. So what is ACT? It's a mindfulness-based behavior therapy. Oftentimes you'll hear those two words, ACT and mindfulness. You'll hear those two words being used. They mean about the same thing. So ACT is about acceptance and willingness, and about behavioral change. And we've got two major goals in ACT. The first one has to do with acceptance of unwanted thoughts and unwanted feelings. So we're going to teach our patients how to sort of be with and experience all the distressing feelings, all the distressing thoughts. And then we teach people how to commit and then take action. And we're going to take action so that we can live our most value-driven life. So how do we apply this to BDD? So we're gonna, for example, accept and live meaningfully with unwanted thoughts, bodily sensations, and feelings related to appearance while moving ahead in that value-driven life. So someone might say, all right, well, I'm gonna meet up with friends for dinner tonight because meeting up with friends, that's a meaningful and important experience for me. And I'm going to do this despite feeling anxious. And I'm going to do this despite my mind telling me that my skin looks extra red today. So the ACT acronym, we've got 3 core themes here, some of which I've just described. So the A stands for accepting all thoughts and feelings, even the ones that are related to anxiety, embarrassment, shame, guilt. We're going to accept all of them because they're going to be part of your experience anyway, so you might as well embrace them. Next, we're going to choose directions that we want to head in life. We're going to help patients to focus on what really matters to them. What do you want your life to stand for is the question that I'll often ask people. And then we have people take actions. Can you move towards these things in life that are meaningful and important to you? Can you make a commitment to move in that value-driven direction? And it's really about giving up control over thoughts and feelings. Oftentimes, patients will say, well, why would I do that? Control can be so helpful. Well, we all want control, right? I mean, there's nothing wrong with wanting control over our lives. And we as humans, we're really great at controlling the things that we can. We problem solve things all day, every day. So, for example, if I don't like my outfit and I say, ew, yuck, and then I get rid of the sweater, or I don't like this gum, I'm going to throw out the gum, or I don't like the color of my kitchen, I can paint the walls. So I have a lot of control over my external environment. And even from a really young age, we sometimes teach children that they can control different things in their lives, like their emotions. If you ever had a parent say to you, don't be scared, honey, right? Instead of saying, it's okay to be scared, it's all right, it's not going to hurt you, right? I don't think many of us as parents say that to our kiddos, but when we tell them not to be scared or upset about something, we send this message that they can control their feelings. So these control strategies, they work really good for controlling things that are in our external world. But then when we try to use those same control strategies to control our private events or internal experiences, it just doesn't work the same. So in ACT, we're going to give up that control. We're going to let our thoughts and our emotions be there without judgment. Because the more that we try to have control over these internal experiences, the more they end up controlling us. So how do we apply this to BDD? I'll often have patients say things to me like this. I need to get control over my skin, my hair, my nose. I need to know what other people are thinking about me. Or I keep obsessing about my nose and the thoughts are so distressing. So how about if I try to get my nose looking smaller? If I could just get these thoughts to stop, then I could be happy. I could go live my life. If I just spend more time finding the right contouring makeup to help my nose look smaller, etc., then I can be happy. And what we know is that these control strategies don't work. So if we're not going to use control strategies, what are we going to use to help us out? Well, we've got this idea about acceptance. And oftentimes people will say, well, what am I accepting? What is it exactly that you want me to accept, Jen? And it's, again, acceptance and willingness of our thoughts and our feelings and our appearance as is, without trying to change it or perfect it. Now, the words acceptance and willingness, I use those two words interchangeably. I actually like the word willingness a little bit better, because I think acceptance has this connotation that you have to like it. And so I might hear someone say, well, you know, Dr. Cullen, you will never get me to like my nose. It's just not going to happen. And that's not what we are trying to move our patients towards, because I think it's an unrealistic expectation, because everybody has certain aspects of their appearance that they really don't like. So does acceptance mean we have to like our appearance? No. But we do need to be willing to have our appearance as is without trying to change or perfect it. Within acceptance, we're going to notice these different processes playing out. So it might sound something like this. I notice that whenever I start to get ready for work, I start to feel very anxious and have a lot of negative thoughts about my skin. But I'm going to continue to get ready anyways, despite these thoughts and feelings. So acceptance is it's a process. It's a journey. It's not really something that you would leave this talk or leave a session with me and go, okay, you know, I got it. I can accept my appearance now. This can take place over a period of time. One of the ways that we get people there is something called paying attention on purpose. So when you attempt to do something that might be a challenge, for example, like join a Zoom meeting, you'll pay attention to all the thoughts and feelings that show up. Do you have urges to turn off your camera, to give yourself reassurance, or to simply leave that meeting early? These are all BDD type rituals. So we simply want to notice that process as it unfolds. So instead of engaging in those types of compulsive behaviors, you might say, all right, this is what happens every time I go to get on Zoom. I feel ashamed of my appearance and then I just turn off my camera. But I'm not going to do that today. I'm going to get back to what I was doing, which is participating in this meeting, back to the present moment. And here's the kicker. This can be really, really hard for people to do, but we've got to accept our distressing thoughts, our distressing emotions in a very non-judgmental sort of way, right? And this is tough for people with BDD because you have a thinking mind that's judging your appearance all day, every day in a pretty negative way. And it really kind of happens in this knee-jerk sort of way. And so it can be really hard not to judge. So I'm going to take a second here. We'll walk through just a little short exercise. And I'd like you to watch what your mind does really automatically. So let's pay attention to this process. That's my favorite. All right. So what did you notice there, guys? Well, I noticed I'm hungry right now, but okay. The other thing I noticed is that our minds are really judgmental. I'm sure as those pictures popped up, your mind just automatically started to do it, started to make a variety of different judgments. And we do it all day, every day. So this is horrible. What an idiot. I look terrible right now. My stomach's never going to be flat like hers. You see, these judgments are the fuel for struggles, right? So when we judge our appearance as something horrible, ugly, distress goes up, and then we need to engage in some sort of ritual behavior or avoidance behavior in order to bring that back down. So how do we dilute this fuel? We move patients towards something like this. I'm willing to live a meaningful life with the nose I have as is. I'm willing to be in a relationship despite not being able to change my height. I'm willing to hang out with friends tonight despite feeling so anxious about my skin. And when we catch ourselves judging, do we say things to ourselves like, stop judging, Jen? Or do we just notice that our mind has done that? And I would say that's just something to notice, and then we hook back into the present moment. Now let's talk a little bit about the ACT skill of diffusion. I love this cartoon because I think it is just so accurate. So it says the worst bullies you will ever encounter in your life are your own thoughts. And if you've ever done treatment with me, you know that I often will talk about how in our thinking mind, we have all sorts of bullies up there who are just saying really mean stuff to us. So what is diffusion? So again, we have the thinking mind. We have the part of our brain or our minds that sends us these helpful and unhelpful thoughts all day, every day. And so for those with BDD, we're going to notice when your thinking mind is sending you unhelpful thoughts. All right. And these are the thoughts that take you away from the things in your life that are meaningful and important. Sometimes people will say, well, yeah, that's an unhelpful thought, but it's so true. And what I always say is that, we're not here to evaluate our thoughts based on whether they're true, false, right, or wrong. We're here to evaluate these thoughts based on whether they move you towards the things you want out of life or whether or not they take you away from those things. Okay. And if a thought pops up that's going to take you away from something that's meaningful and important, that's one that you're going to want to diffuse from, get distance from. All right. So we're going to step back from our unhelpful thoughts, even if they're true. And this allows us to pivot and turn back into the present moment. So here's an example. So here we have two guys, and they have the thought up on the screen, there's something wrong with you. All right, and we have one guy who is practicing diffusion, and this other guy, the guy on the left, he's fused with that thought. He's leaning into it. He's sweating. He looks distressed. He's fused. He's getting wrapped up into that thought. Versus the guy on the right, he's stepped back a bit. All right, he's got some distance from that thought. And he's not doing this. He's not putting his hands over the screen. I don't want to hear that. I don't want to see that. All right, he's noticing the thought. Okay, he's noticing it, and hopefully he's noticing it without judgment. So how do we put this into action? There are a lot of different diffusion techniques, and I just put two of them up here. These are the ones that I find my patients sort of gravitate toward. And the first one is called Thank You Mind. And it goes something like this. if I had this unhelpful thought, I can't go to work today, my skin looks too red. My response might be, oh, thank you, mind. Thank you, mind, for telling me that once again, my skin looks red. All right, for telling me I can't go out. Much appreciated. Okay, so I thank my mind for sending me that thought. Now, why thank you? Why would I say thank you if my mind is sending me an unhelpful thought? Well, we kind of want to make friends with these thoughts, right? Like we don't want to, what am I trying to say? We don't want to describe them as something that's awful and negative, because remember, if we do that, we're going to try to get rid of these thoughts. We don't want to do that. So we're going to thank our mind. We're going to allow those thoughts to be there. And the behavioral response is that we'll continue to, for example, move towards the shower so that we can go out for the day. What we want to be careful about is that we don't talk back to these thoughts. And so what can happen is if somebody's mind says, oh, I can't go to work today, my skin is looking red. If we then answer and say, no, my skin doesn't look that bad today. It looks all right. I can go out. Well, then people can get stuck. Now we call this the two lawyers. We've got these two lawyers and they make really good arguments on both sides. Go out, don't go out, go out, don't go out. And this can just go on and on and on. And so what I tell my patients to do is that when the two lawyers show up, you step out of the courtroom. You don't have to listen to your lawyers going back and forth. It's just something to notice. And you step out of that courtroom and into your life. The second technique here is the technique of I'm having the thought that fill in the blank. So for example, if I said my neck skin is saggy, I'll just wear a scarf again today. That's a camouflaging behavior. I might say I'm having the thought that my neck skin is saggy and that I need to wear the scarf again today. Or I'm noticing I'm having the thought that my neck skin is saggy and I need to wear the scarf. All right. So this is a technique that helps people to see that these are just thoughts, nothing more, nothing less. These are just thoughts. These are words that our BDD mind has sort of strung together in an effort to scare us. And in ACT, we talk a lot about focusing on the process, not the content of what your mind is saying to you. So it sounds something like this. I notice that whenever I get dressed, my mind sends me unhelpful thoughts about my neck. It's just something to notice. Okay, so I'm focused again on the process that plays out when my mind sends me unhelpful thoughts. All right. Now we'll transition to talking a little bit about values. This is actually my very favorite part of ACT to talk about. So the picture on the right here, one of my patients actually sent this to me because he knows how much I love to talk about values. But somebody has this license plate in Massachusetts, and I wish it was mine, but anyhow. So we all have values, and values are the things that we deem to be meaningful and important in our lives. It's the things that bring us vitality and abundance. All right, and so some of my own values, I put a couple examples up here, is having a successful career, being an attentive and loving mother and spouse, taking care of my physical health, and being a supportive friend. And if you watched me throughout the course of a day or the course of a week, and you just sort of watched what I did behaviorally, you would see me living out these values. So having these values, it guides us each and every day. People with BDD can get so preoccupied with their appearance and trying to change it, perfect it, hide it, etc., that the things that they value just sort of fall off the map, unfortunately. So how do we use values as a skill that we would put in somebody's toolbox? So ACT for BDD looks to de-emphasize appearance and emphasize the values that may need your attention. All right, so we're going to pivot away from all things appearance related, and we're going to look at everything else that opens up to us in our world. And I'll often ask patients, who do you want to be in this world? Who do you want to be? If you were stuck on a desert island, name 2 or 3 people you would want with you. If you only had 24 hours left in this world, how would you spend your time? Right? When you ask yourself those kinds of questions, you'll know what your values are. And I put up this example here, someone that said to me, I'm going to keep my dinner plans with Emily tonight, even though my skin looks red, because I value my friendship with Emily. And you see how if I then went out to dinner with Emily, even though, I didn't really like the looks of my skin that day, now I'm doing an exposure exercise. I'm heading out into the world with my defect, and I would be hooking into the conversation with Emily. And every time my thinking mind would send me some sort of unhelpful thought like, oh my God, she's noticing my skin, say, oh, thank you, mind. You've joined our dinner. Have a seat right next to us. And then we pivot back into the present moment, into that conversation with Emily. Another example, I'm going to take my son to the playground right now, despite my thinking mind telling me that my right eye is bigger than my left, because I want to be a fun-loving and supportive mom. And then people might say, but that's going to make me feel anxious. I can't do that. And so what do we say? Well, I guess that's coming with you to dinner, or it's coming with you to the playground. So we have our cartoons again. This is committed action. He's going to take his self-doubt, his uncertainty, his anxiety, and his ugly memories, and he's going to get on the path, values. But what happens? We start to go down this path, and we're going to bump up against some roadblocks. These are internal roadblocks, right? So our distressing thoughts, feelings, etc. Now what do? Well, we put this blob in the back seat. We bring it along for the ride, right? And once we do that, we say, hey, come on along. You see that roadblock has been moved over to the side. All right, so while I have your attention, I'm just going to shift away from ACT for just a moment and talk about what doesn't work in BDD treatment. So, as I mentioned earlier, most people with BDD will first try to get some sort of medical treatment for their appearance flaws. And what we know is that these cosmetic changes don't actually help at all. Usually one of 2 things happen. So say I had BDD around my nose and I ended up getting a rhinoplasty, a nose job. And at the end of it, I might look at it and go, oh no, it looks terrible still. And then go get another one and another one, all right? So that's one scenario that happens regularly. I've seen that exact scenario play out before. There's another scenario where somebody, say, goes to get a rhinoplasty and they actually like the way that their nose looks now. But then their BDD will shift and they will say, oh my gosh, Jen, I was so focused on my nose that I didn't notice that my ears, they're bright red. Oh no, now I have to go get my ears fixed. You see how the BDD jumps around. And so what we tell people is that it's not your appearance itself that needs the attention. It's your relationship with your appearance. That's where we want to do our work. How about hypnosis or natural remedies or diets? There's really no scientific evidence to support their efficacy as well. How about psychotherapy to uncover childhood trauma? Well, this type of treatment might be helpful for some other disorders, but not for BDD. How about diet supplements, diet pills, extreme diets, etc.? Well, these don't work either. Sorry about that. Because people will say, oh, I lost 5 pounds. This is awesome. My stomach looks flat. Well, if I could lose 5 pounds, I could probably lose 3 pounds or 3 more pounds. And off they go. All right. Few more pounds, it's never enough. So in conclusion here, if BDD is the problem, efforts to improve or hide body appearance will not be helpful. And I think that's about it. Wow, right on target here for time. So I listed a few resources here if you're interested in learning more about ACT. The first here is a website called contextualpsychology.org. And this is, it's an ACT website, and they have all sorts of really good stuff up there for you to read. My favorite ACT book is called The Happiness Trap. I highly recommend it. If you or anybody that you know suffers from BDD, this is a great book, as is the workbook, the Mindful Way workbook. And then we have our BDD Bible called The Broken Mirror. Also highly recommend this book by Kathy Phillips. Anything you've ever wanted to know about BDD is in that book. And then there's my email. If you have questions, comments, etc., don't hesitate to reach out and send me an email. The end.
Thank you very much, Jen, for a wonderful presentation. I'm really glad we got to do, we were talking a little bit about this, a BDD specific kind of presentation. And I really think one of the important points that I'm glad that you raised is also how high the prevalence rate of BDD is in inpatient settings.
Oh my gosh, yeah.
Especially in settings where it may not be easy to identify BDD symptoms unless you have someone who's worked with OCD or BDD before.
Yeah.
And I think that's a really big need for our field as a whole, because that stigma and shame that you mentioned really plays a profound impact and can, make inpatient kind of work difficult as well in terms of figuring out what's the best fit to continue treatment moving on. So I'm really happy we got to have you on today.
Oh, thank you.
To present. I know I have to say that I love the cartoons and how they the diffusion one was awesome. I see in the chat that there's actually some other people who really liked the analogies and the cartoons. One comment that they were a big fan of the lawyers leaving the courtroom analogy.
Oh, yes, good.
So we have a few questions, and if anyone else has other questions, please feel free to put them in the Q&A box or in the chat, and then I'll read them out. So one of the first ones that came in was, what if one finds that what they value most is looking good or attractive and getting good external validation or positive feedback or attraction for their appearance from others? What do you do with that value? Yeah,
read the first part of that question again.
What if one finds what they value most is looking good or looking attractive and getting good external validation or positive feedback?
Yeah, good question. So when we think about values from a mindfulness perspective, values are what we spend our time doing, all right? So what we spend our time doing and how we do them. So, being concerned or preoccupied or needing to look good isn't necessarily a value per se. That's something that pushes, that your BDD pushes you toward, all right? So, I'm not saying, hey, just completely, give up all efforts at sort of looking good and feeling good, right? But can you look okay, or just look the way you look, while engaging in other things in your life that have nothing to do with appearance?
It sounds like in some ways what you're saying is the idea of balancing values.
Mm-hmm.
Is that even if there's that maybe goals where it may not be a full value, but might be a goal that returns, can you balance the other values in your life at the same time as well, and not kind of get focused on one specific part that your BDD wants you to hone in on? Would that be accurate?
Yeah, definitely. If somebody's saying, well, I go to the gym 5 times a week because I want my stomach to look flat. So I'm just, I'm pounding it out at the gym. I might say, okay, well, why don't we go to the gym 5 days a week, but can we go for different reasons? Can we go because we're more invested in our physical and our mental health? Can that be why we go, as opposed to, I need to change my stomach, I need to change my stomach?
Excellent. Do we have other questions? We have others in, oh, here we go, one more. So one question that came up is from an individual with BDD, and they said it's been harder to deal with it as they age. Especially, and they mentioned, so as I age, as all my imperfections, in quotes, that I had when I was younger are now a reality. Identifying kind of wrinkles, dark spots on face from the sun. How do you recommend I deal with this now when it feels like some of those things that they were concerned about to begin with have come true?
Yeah. So again, it really goes back to, if you have thoughts about your skin, right? And maybe they are true. Who am I to say if you have dark spots or you don't have dark spots? But what we want to stay focused in on is, when you have those thoughts about your skin, if you get all wrapped up in them and you listen to them and you allow them to bully you, is that going to move you towards the things that are meaningful and important in your life? Or is it going to take you away from those things? All right. So can you accept your dark spots, your wrinkles, whatever it is? Can you be accepting? Can you be willing to have them as is without trying to change them, while living that meaningful life? Now, you don't have to like them, right? I don't like mine either, but they're here to stay. So I stay connected and focused on other things that have nothing to do with appearance, other things that are meaningful.
I really think that kind of almost relates back to a really great point that you made in terms of reframing the idea of acceptance. That acceptance and necessarily liking it aren't necessarily the same thing. I think that's I know kind of, when I think about that personally, one of the things that's most challenging, right, is thinking about that terminology too. I think that was a great way to reframe it. Thank you.
Yeah.
And so I have a thank you in the chat.
Thank you for coming.
And talking about, I think actually this kind of brings up, I think, an interesting point, is some of the challenges, with COVID and BDD, while initially the experience of COVID may actually reduce some of the anxiety in certain instances around BDD. What could be some of the concerns around COVID and BDD in the long term?
Oh my gosh, what I've seen in my patients, COVID has really kind of made a mess of things here, is that, a lot of my patients with BDD isolate, hide, etc. from the world. And COVID has almost given people a reason to do that even more, right? So for somebody who stayed indoors a lot, now they're really staying indoors, and BDD goes, ooh, I like that, I got you. Let's really keep you inside. And as things are starting to open back up and we're all starting to come out of the woodwork, It's my BDD patients, I think, that are struggling the most with that. The other thing that I've watched happen is that the masks have become a camouflaging behavior for some people with BDD. And I'll hear patients say, "Oh, I'm so happy. I love this mask. I get to wear the mask. I can hide." And now, uh-oh, people are starting to let go of the masks a little bit. And because wearing the mask, camouflaging with the mask was a ritual, now it's become another thing that we've got to sort of work towards, is how do we decrease the, wearing the mask as a compulsive behavior.
That sounds like the fuzzy line sometimes between, like, with rituals in general, right? Where they start out almost functional, but then quickly move to the other end, and then they have kind of this dual use. One other question that just came in was, what are your thoughts on masculinity and the constant stigma of doubt and insecurity associated with BDD?
Say that again. What do I think of masculinity?
And the constant stigma of doubt and insecurity that's associated with BDD.
Well, I would say, with masculinity or femininity, whether you're a male or a female, BDD, it's a doubting disease, just like OCD, all right? And regardless of gender, it is always going to have you doubting yourself. So, oh, I went out with friends tonight and I had a good time, but I don't know, like, did people notice my wrinkles or my red skin? I just don't know. I felt like I looked okay, and in steps the BDD and our unhelpful thoughts, right? So, sort of doubting us, doubting what other people say or do in regards to our appearance. It's just part of that toxic concoction of BDD.
Well, with that, Jen, I'd just like to say thank you again so much for coming to talk about BDD and for an excellent presentation. It was a pleasure to have you.